And older Americans have a suicide rate that is greater than their share of the population. One reason may be that symptoms of depression in the elderly can be subtle and they are often dismissed as a normal consequence of growing old.
Depression in elderly. What is depression? Depression is a common issue with older adults, but is not a normal part of aging. Depression may be overlooked for some older adults who have depression. Sadness may not be their main symptom. They may have other less obvious symptoms of depression, or they may not be willing to talk about their feelings. Therefore, it is less likely to recognize that these patients have depression. Signs and symptoms of depression: sad, emptiness, fatigue, abandon, loss of interest, hobbies, social withdrawal and isolation, decreased weight, loss of appetite, sleep disturbances, loss of self-worth, hopeless, irritable, and anxious, suicidal thoughts, decreased concentration, and aches and pains. Depression without sadness. Many elderly don't say they are sad, but depression symptoms still occur, such as having low energy, decreased motivation, and physical complaints such as arthritis pain, headaches, which are worsening. Depression clues: unexplained aches and pains, feeling hopeless, having anxiety and worries, memory issues, lack of motivation and energy, irritable, loss of interest, neglect of personal care, such as skipping meals, not wanting to do their ADLs, and neglecting their hygiene, as well as slow movement and speech. One important sign of depression is when people withdraw from regular social activities. Rather than explaining their symptoms as a medical illness, often depressed persons will give different explanations such as, "It's too much trouble," "I don't feel well enough," or "I don't have the energy." Causes of depression: health issues, which damage their body from surgery, having an illness or decline in status, loneliness, decreased sense of purpose, loss of identity due to retirement or physical limitation, fears about death and anxiety, the recent loss of a loved one, death of friends, family members, pet, spouse, or partner, stress, having difficult relationships and any stressful situations, genes, having family history of depression, and as well as brain chemistry. As a healthcare provider, we should know which medications can make depression worse. These medications include blood pressure meds, beta blockers, sleeping pills, calcium channel blockers, medications for Parkinson's, steroids, painkillers, estrogens, and high cholesterol drugs. Changes in the older adult's sensory abilities or environment may contribute to the development of depression. Examples of such change include changes in vision or in hearing, changes in mobility, retirement, moving from the family home, or neighborhood changes. Depression in older adults is linked to their physical illness. Be aware that medical problems can cause depression in older adults and the elderly. This may be directly or as a psychological reaction to their illness. Any chronic medical condition, particularly if it is painful, disabling, or life-threatening, can lead to depression or making depression symptoms worse. Some examples of illnesses which contribute to depression are Parkinson's disease, stroke, heart disease, cancer, diabetes, thyroid disorders, vitamin B12 deficiency, dementia, Alzheimer's, lupus, and multiple sclerosis. How is depression treated? Depression can be treated with the right support, treatment, and self-help strategies. Feel better and live a happy life. Medications such as antidepressants, which take several weeks to work, which may include side effects such as headache, nausea, difficulty sleeping, nervousness, agitation, and restless. Psychotherapy, teaching new ways of thinking and behaving, changing habits that may contribute to depression. Alternative medications. Herbal remedies and natural supplements can also be effective in treating depression, and in most cases are much safer for older adults than antidepressants. However, some herbal supplements may cause interactions with certain medications or occasionally carry side effects, so always check with a doctor. Some alternative medications are omega-3 fatty acids, which boost the effectiveness of antidepressants or work as a treatment for depression alone. St. John's wort can help with mild or moderate symptoms of depression but should not be taken with antidepressants. Folic acid can help relieve symptoms of depression when combined with other treatments. SAMe may be used in the same place as the antidepressants to help regulate mood, but in rare cases can cause severe side effects. Untreated depression can lead to disability, can worsen symptoms of other illnesses, lead to premature death, or can be a result in suicide. Why is it important to treat depression in the elderly? Depression throws a dark cloud over our emotional well-being, draining away pleasure and hope. Depression can lead seniors to further isolation and despair. Depression lasts long in the elderly and can result in unnecessary or premature placement in an institutional care. If depression is not managed, it can compromise the treatment of other conditions and can increase the risk of prolonged disability or early death. Untreated depression can also leave seniors more vulnerable to developing other serious health conditions such as heart disease, infections, and immune disorders. Depression can make people feel angry, irritable, and anxious. This can rob families of the pleasure of their loved ones' company and place an additional burden on care providers. The risk of suicide in elderly is high and is particularly high for depressed elderly men. What can we do as healthcare providers? We can offer support, understanding, patience, and encouragement. Talk to them and listen carefully. Never ignore depressive comments. Encourage physical activity, which has a powerful mood-boosting effect. Encourage them to get out, walk around, get some fresh air, or join any activities that are being held that day. Connect with others, invite loved ones to visit, or keep in touch over the phone. Build new friendships with others. Get enough sleep. Symptoms can worsen with less sleep. Maintain a healthy diet. Avoid sugars and junk. And we can encourage nourishment. Laughter. Provide a mood boost. Tell stories and jokes with others. Remind them that with time and treatment, it will get better.